So the Medicare question of the day is, will hospice be covered when I am on Medicare? Absolutely. I just went through this recently in the last couple of weeks. Hospice is covered at 100%. You don't need to worry about anything. What I would say about hospice care, though, is not necessarily the insurance part of it, since we do know it's covered at 100% with Medicare. And that's with Medicare Supplement, Medicare Advantage, it doesn't matter. It's covered at 100%. Is that you want to really vet your hospice team. There are a lot of different hospice companies out there. Some people have a misconception of what hospice is. They think that someone's going to come into the home and be there 24/7. That's not necessarily what hospice does. Hospice is there. They have a nurse, they'll have a CNA, they'll have a pastor, a social worker, and then there's a lot of volunteers that will volunteer story time to music therapy, to art therapy, massage therapy, but not all groups do that. And a lot of people with traditional Medicare or traditional hospice care, will just come in and give you comfort. Comfort meaning they're not sending you to the hospital anymore. You're not going there because they want you to pass at home or wherever you're at in comfort and in peace. They're not doing life savings events for you anymore, or that person. So for instance, if you've got a loved one who's diabetic, let's say, and now let's say there's diabetes or infection because there's a lot of people get amputated toes from neuropathy, and let's say now the infection's going up the toe, and now you're not losing a toe, you may be losing a foot, and you're in your 80s or 90s. Can you really withstand a huge surgery like that? So that would be at your family's discretion. It's not that you can't go to the hospital, but it kicks you off hospice and then you got to come back on. But do you want to endure that kind of surgery if that's what it is? Yes, they'll give you every antibiotic to keep you going, but do you want to endure the surgery? So these are some really tough conversations that you need to have with your loved ones around you to know what they want. And if and when they do pass, do you want to be cremated? Do you want to be buried? These are uncomfortable conversations that we have to have with our loved ones, but it's really important. And when do you think, and you should talk to all your loved ones around you that you will be caring for when this happens, when is that time